Good afternoon, everybody, and welcome to what is the fifth of our webinars designed to help community or groups, organisations and businesses with planning as they plan to return to the operations of the day safely and in line with government guidance, adhering to requirements of health and safety, whatever your new day is going to look like. And I'm sure it will be very different for many of us. Today's webinar is focused on the important voluntary community social enterprise sector, and we're delighted to welcome and call upon the experiences and insight of our panel. Ladies, and for the first time it is an all ladies panel. Sorry gents, but I do know that you are very well represented in the audience, but at the moment it's just a ladies all panel. Today we are joined by Louise Parrot, CEO of Pure Innovations Group, who will share her experiences in coping with coronavirus within a large multi-sited organisation. And Sarah Turner is Health Protection Lead Nurse at Stockport Council. Joe McGrath, Sector 3 Lead in Stockport, and our Health and Safety and Risk Assessment expert, Michelle Hay. So hopefully together we'll be able to cover all your questions and all your queries that you might have. I'd like to start off by asking each of the panel to tell us a little bit about their experiences in dealing with the coronavirus pandemic, because I'm sure there are lots of similarities and things that you can all relate to. Certainly within their own organisations and in supporting our communities. So I'll start off with Louise. Louise Parrot-Bates, can I introduce you please, Louise?
Thanks, Helen. Hi, everyone. It's been, I think, an experience and a journey of learning. I think even when your introduction and you talked about the government guidelines, I can feel quite overwhelmed with the journey over the last 15 weeks if we reflect upon it. And what it's meant for Pure, we do operate over multiple sites right across Stockport and even further across Greater Manchester. And for many people that are tuning in today, the first thing to note is there has been lost income and irrecoverable income that will never come back to the organisation. It has meant that we have had to redesign most of our services, what we do and how we do it. We've also kind of had to manage that high levels of anxiety with both staff and our clients as well. And some of our clients already had quite poor mental health. So that continues to be a little bit of a challenge. And we need to support people to return safely to the workplace and to the activities that we undertook before. It's the new normal looks very, very different. So people are returning to work and people are returning back to services and they look significantly different. And people need time to adjust to the different way of working and the different routines that we have in place. And I also think kind of be kind to yourself that the new normal is actually okay. It's okay. And I think if I was, because I know we're quite a big organisation, so we were able to mobilise resources and people with the skills to be able to start looking at, well, what's step one on our journey to work? And I think a message I'd like to get across today is, regardless of how big or how small you are, it's okay and you're going to be able to do it. There's a lot of support out there, there's a lot of guidance. So I'd like to think in an hour's time you will feel more encouraged and more empowered to take that first step in your phased return to work. And like most, on the 20th of March, which was when we got notification that our cafes literally had to shut by the Prime Minister at kind of 6 o'clock at night, and they were not to open the following day. So quite quickly, you have to mobilise your resources as to actually don't open the cafes tomorrow and kind of relocate and redistribute all of the food that was in there and communication, letting people know. That was, I think, the first real start of the journey as to how we needed to think differently and redesign what we do differently. 4 days later, we've shut all of our day service operation except for a handful of people. That equated to 200 people with a learning disability that had nowhere to go during the day. But I think, like a lot of people that are tuning in today, there was about a quarter of our work that continued, and that was around wellbeing and mental health and alternative education provision. And they have adapted and been so innovative and creative to allow people to meet the needs in really different ways. And they have been vital for some people out there in our communities. So it has been a journey. We opened our cafes back on the 13th of May, and we opened day services back on the 8th of June. So we've had a number of weeks now as to learning as to what's worked and what's not worked in our journey. And if you haven't yet opened some of your services, I think the first thing I would say is it's not rocket science, and you just need to take the first step. And the first step might just be going into your environment with a tape measure and identifying how many people can actually safely operate in this environment, and what are the activities that are going to take place. So, my advice would be start small, build up, involve staff or volunteers, whomever it may be, along the way, along the journey, and do that kind of plan, do, study, act. There's loads of things that we got wrong, but we took the feedback, we made an adjustment, and then we go again. So I'm sorry that's quite a long and convoluted kind of introduction into some parts of what our journey have been. So I'll pass on to somebody else now and then take questions later.
Okay, thanks, Louise. I think that's really important. One of the points that you made there is it doesn't matter how large or small your organisation is. Basically, we're all trying to follow the same principles and put those into place. And very good advice there. We're not all going to get it right at the first time. So plan, do, study and act is fine. Review it and don't be afraid to make the adjustments that are required if it doesn't work out. And I think in your case, being able to pull your own team along, as well as trying to educate your clients into the new normal, is obviously a big challenge for you, and I'm sure we'll have some questions about that afterwards. Sarah Turner, can I introduce you again as the lead nurse at Stockport Council? And I think it would be really useful for people to hear about the experiences that you've had, what your role is, and what advice you can give. And as I say, if you run over, it doesn't matter. I think it's really important to get all this covered as much as we can. So Sarah, I'll hand over to you.
Welcome everybody. I'm Sarah Turner. I'm the lead nurse for health protection, as Helen said. Just to give you a little bit of background about me, I've been involved with infection prevention and control and health protection for the last 20 years, straight out of nursing really into managing a team in the hospital, and then moved into the community. The pandemic is something that within my lifetime, obviously, within everybody's lifetime, we've not seen, but it's something that, as an infection prevention and control professional, I've been planning for since I started within this role. And one of the first times that we started to look at something like this was when we had the swine flu or potential swine flu pandemic a few years ago. At that time, I think we probably thought that we'd really got away with it, and it really didn't impact us as badly as it could have done. This has really been an eye-opener for everyone, everywhere, all of the time. And I've been involved with coronavirus planning, or the start of this, since January, since we first started to hear the first cases from Wuhan, and how they were affecting the Chinese population, and how we would be potentially affected moving forward. Since then, I've been involved in the response across the whole of Stockport, not just in one sector. So I've been involved in the response to the hospital, response for voluntary services, the response for environmental health officers here at the council, in response with all of the care homes, so 61 plus care homes, all of the testing that's going on, all of the contact tracing that's happening at the moment, which is the next phase of the pandemic response, and also all of the recovery responses that Louise talked about before. So I've been involved with Louise, looking at her plans to return back in a safe way, also helping other day services providers return back, and also care homes to start thinking about how they return back to some sort of normality. And the first steps we've done there are around socially distanced visiting in gardens for family members. And this week we are going to be putting out some guidance around, for example, hairdressers returning to the care sector, because these have a big implications for everybody returning to what is their normal. So we've dealt with about I think about 38 care home outbreaks, and we've also managed to keep about 20 plus care homes without any cases in at all, which is fabulous for the care sector. So they've done absolutely brilliantly. But as I said, I'm here to help with any sort of plans to go back, any risk assessments that you want to be looked at, any conversations around contact tracing, any conversations around PPE, and that's one of the biggest things again that I've been involved in since the beginning of this, and the establishment of the PPE hub at the town hall and the provision of that PPE into the wider care sector. So I'm here really as an advisory body, here to help. And if you've got any questions, even if you think they are stupid, then please do get in touch, because any question I can try and help the answer with.
Thank you very much, Sarah. I'm sure there will be no end of questions. I think what we'll probably do at the end of this webinar, we are recording it, so it will be available for people to review and to view for the first time. And I think it might be quite helpful if we were able to include, Sarah, your email address, so that people can get in touch with you and direct the questions to you if we're not able to cover everything off today. So if I can turn to Jo now. Jo, as I said, is the Sector 3 lead in Stockport, and Jo deals with a number of different organisations across the whole sector. So I think, Jo, if you can give a sort of a view from not just sort of the sectors where we're looking at the primary care home type environment or the employability type environment that you're involved with, but also that Louise is involved with, but also, as I say, across the whole range, because we've got everything. We've got play groups, we've got scout groups, we've got guide groups, we've got no end of different voluntary organisations. So I think it'd be really useful if we can hear from you, Jo. Thanks.
Yeah, sure. Hi, I'm Jo from Sector 3, and for those that don't know about Sector 3, we're a Stockport-based charity that was set up by the sector for the sector, and our real ambition really is to just create the conditions in which our sector can not just survive but thrive. As we've seen with the pandemic, our sector stepped up very often as first responders to this, because our sector is locally based. We're based in neighbourhoods, we're based at grassroots, and we've just done such an amazing job in helping protect and support and ensure that people don't drop deeper into crisis. So a massive thank you to all the people on the call that have been involved in work around this. What Sector 3 are keen to do is to be here as a sounding board for you, to provide support that you might need when it comes to recovery. Stockport's VCSE sector, based on the State of the Sector survey a couple of years ago, 70% of us are micro enterprises. We're small. So we don't have the resources that we might, that the larger organisations might have. So I'm really keen that those on the call today can get as much information out of us today as possible to help you reopen safely. Sector 3 can also support in terms of funding. We can help look over funding bids if funding is an issue for you right now, because I'm aware that there's plenty of organisations that have seen an increase in demand for services but a decrease in income. And we're here to help network you with other organisations and get support off your peers. So we run a weekly Zoom drop-in session, and that's a sounding board. For those of you that don't know, but we've got a new website, so we'll give you the address for that. And on that, you can also sign up to our newsletter. So any new kind of information that's coming out around reopening and recovery, we can kind of connect you into those communications and make sense of it for us as a sector, because obviously the language can be nuanced between commercial economy and our sector, so we'll help kind of navigate that path for you. Just wanted to also say that we've developed a checklist for organisations that are looking to reopen, using Louise as a case study on there. So again, that's available on our website under the resources section. So yeah, any questions around recovery, I'm here to answer, and obviously I'll be here after this webinar, and you can contact me anytime if there's any further support needs that you have.
Thank you very much, Jo. I'm sure that there's going to be so many questions, but we'll make sure that we put all the information, all the links on the SK Business Recovery website, so people can go to it and find out later. And as I said, we've as far as opening up safely, looking after the health of people, and also your risk assessments are really, really important in this. But Michelle Hay, who is our sort of local expert in all these issues, can hopefully sort of shed some more light on it. So I'll pass over to you, Michelle, now, if I may.
Oh, hi, thank you. Welcome everybody. Yeah, over the last few months and going back to sort of March and the sudden closure of businesses, I think was very difficult for people because it was enforced, even though they understood what they needed to do. And over those last 4 months, I think my role has started off as managing and supporting people that are now working at home quite a lot, because a lot continued to work at home, which was very new, completely new to a great many people. And you know, from an employer's point of view, they're still responsible for those home workers who are also lone workers or remote workers, if you like, and they come with their own set of potential risks to be identified. So there's been a lot of that in the first few months, and then of course as the government has released dates when different sectors can start operating again, I've been focused with various businesses to get people back into the workplace as safely as possible. And risk assessments, I mean, everybody knows the term risk assessments, but very few people know how to do them. And they do follow a basic format. It's the content that's different. So the way that you do them is set by the Health and Safety Executive, but the content varies depending on what risk you're assessing. And what I've been doing over the last few months is building up a comprehensive risk assessment that identifies all the potential hazards, and using the government guidelines. And I've listened to, you know, been involved in a lot of webinars from my health and safety side of it, things, building up that list of controls of possibilities that people could put in place. And one thing is for sure, no business or organisation will be able to put in every single control. It's just not feasible. So what we look at is mitigating the risk. So doing as much as you can. It must have the obvious things in place, like the distancing where that's possible, and hand washing facilities, and the very, very basics. But then some of the things, they're just not possible. But as long as you've got a comprehensive list of all the other things that you are doing, you're reducing that risk down to its minimum for that environment. And that's the main thing, really, that you've done everything that's reasonably practicable. I've come up with a compliance checklist which will prompt people to say, we could do that, no, we can't do that. And it just helps give people that comfort from you know, visitors, employees, employers, that they can't do any more. It's really now down to human behaviour to put into place what we'd like the new environment to look like. So that's really been my role, and of course it will change week to week as different guidance comes along, and or the medical profession chip in and disagree with government, and you know, we've got that side of it as well to contend with, haven't we? But you know, everybody just needs to be able to do the best that they can.
Sorry, jolly sound advice there, Michelle. I think one of the other things is that if we can mitigate the risk wherever possible. I know, speaking to Lou earlier, you bring a lot of your clients in on transport, your own transport, Lou, where it's not possible to have people socially distancing at 2 meters, but therefore you have to cover over other things that will mitigate the risk, like opening the windows, etc., etc., and, you know, making sure that your hygiene practices are in place. So I think hopefully that's given everybody who's on the webinar today a sort of a brief insight into everything, but we will go to some particular questions, and I will try and direct them at our panel members as we see fit. I've got a call in from Dave Fraser, who's in our audience, and I think this is probably one for you, Louise. In seeking to open multi-use building centres, what are the mistakes that should be avoided in your experience?
There's some key. I think communication is key. That has been key from the beginning, and we've learned from that. We were communicating with our teams, and bearing in mind we employ 250 staff, 187 of those staff were furloughed overnight. And what we did was we communicated with them when there was something to communicate. But actually, the feedback that we got from teams is that was increasing people's levels of anxiety, because if they heard nothing, they were starting to worry about what's going on. So about 11 weeks ago, we started with a weekly newsletter to staff. All staff right across the organisation, what's changed this week, what's opened this week, how it's going, feedback from staff in relation to those that are back in work. So I think communication with staff, regular communication, so our newsletter goes out every single Thursday and people now expect that, has been key, and as it has been with our parents and carers and our clients that use our service. I think I'll go back to what I said at the beginning, which is start small. So in each locality we started with how many days a week should we open. So our cafes didn't open 7 days a week. They were the first to go back. They opened 4 days a week. And then we looked at the environment and said, you know, can we create a one-way system in here? And how many people can work safely in here? Usually we have 5 members of staff in our cafe and potentially 5 clients. We've actually only got 2 people that can safely operate in our cafe at the moment for a takeaway offer. So I think first and foremost, it was planning the environment, preparing the environment, and don't rush it. There's nobody's expecting you to rush this. So we needed to do a deep clean. We brought staff back in to help with the recovery plan. We got staff involved in the risk assessment that Michelle has just spoken about. And that allayed some of their concerns as well. And they felt that we were kind of tackling this in a very safe and organised way. And then we created new routines in each of our buildings. So in every single building that you'll go in, there will be a visual sign, and this helps with staff as much as it does with clients. A visual sign, the first thing that you do is just hand sanitize. And there's bins, there's tissues, there's wipes in every single room that we are occupying, and having as many visual triggers for people to be able to follow. Tape on I think visual prompts are really good because they're great for our clients who don't always understand a 2 metre social distancing rule, for example. Some of our clients just do not understand that. But visual prompts are really useful for our clients, and new routines. So some of our clients, that their hand washing hygiene routine isn't great. So now we've just introduced a routine which is every hour, regardless, everybody, every member of staff, every client, hand sanitizers. Now, clients that have been in from the beginning know that routine is coming. So they are now talking to other clients saying, time to hand sanitize. So the more routines that you can get in place, the better in each of the environment. And the other thing that we did, which staff have fed back to us, it was really useful, we built in an end of day feedback for each team to say what's gone well, what's not working so well. and then you make your adjustments accordingly. And that seems to have helped with staff feel like they're being listened to, because all of the staff have complained about the PPE. Well, not all of them. The majority of staff don't like wearing the PPE. And it is, and you'll find, you know, people will mess with it a bit, and you know, it's not great. Some of our clients will not wear it at all. So for clients, it's a little bit different. If they don't want to wear it because it distresses them, or they don't. But all staff, again, we made it that people have to wear face masks, and then the appropriate PPE for other things like personal care, or at meal times with supporting people with eating and drinking, etc. So each environment is very different. We had a checklist for each environment, and when staff return to work, they have an induction. I thought that was really important as well. So they have an induction which covers, it's a little bit from me, then it goes into the risk assessment. Everybody needs to have read the risk assessment and signed the risk assessment. And also it's really around how we maximise infection control. So, you know, they do the e-learning infection control again, regardless of whether they've done it at the start of when they're employed by us, and go through the policy. And each member of staff is walked through their environment and what this new routine looks like for them. I hope that helps.
Sure, that does help an awful lot. Thank you very much, Lou, for that. I love the idea of getting into the routine of hourly washing. It's like 11 o'clock, come on, wash your hands, do, you know, just, it's repetitive things, isn't it, that I think help people to get into the routine, and doing a checklist for all the different aspects, because you've all got obviously different issues and different challenges that you have to face. I'll just go down to one of the questions that was submitted before today from Elaine Clary, who runs a parent toddler group at Woodley Methodist Church. And she says 6 out of, I think it's probably Joe, you might be best placed to answer this. 6 out of 9 volunteers are aged 70 or over, and all would like to continue helping at the group. Are they still able to do so? Joe there?
Sorry, I am, yes. I don't know what happened then.
Okay, did you hear the question, Joe?
Just could you repeat it, sorry?
6 out of 9 volunteers at Woodley Methodist Church, at the parent toddler group, are aged 70 or over, and all would like to continue to do this work. But are they still able to do so?
It's my understanding that yes, they can, as long as they've got the adequate protection, absolutely. I think it's really important for people. Volunteering has it's been a really great way of reducing isolation and loneliness. So, you know, for volunteers to come back out and start to do that activity again, it can really help with mental health. So I do think as long as they've got the adequate protection and the environment in which they're working in is properly risk assessed, then absolutely.
That's good news. And can I also go on to, I think this is probably one, again, you know, Lou, you've got loads of experience in handling these, so I'm going to throw a couple of more questions at you, if I may. We can space out chairs for adults to sit on, but how do we go about socially distancing children?
It's a tricky one. I don't know if you can, if I'm perfectly honest. You can put all the reasonable measures in place. Another thing that we did, which was really, really helpful, and I hadn't thought about it, and that's why it's the beauty of working collectively with others. For some of our clients, if there is a chair there, they will use it. So we had to remove all of the chairs and just put out the chairs, space out the tables differently. So the visual cue is there's only one chair there, so that's the chair I'm going to use. But I can guarantee if there's 3 other chairs there, people will start congregating. So we had to declutter. Our buildings have never looked so tidy and sparse, and people never been so clean, if I'm honest. So we've removed all of the rubbish out of it to reduce people kind of not social distancing. I think it's really hard. Some of the activities that we undertake, we cannot adhere to that social distancing guidelines. We can do what is reasonable with the people that we are supporting and working with. I don't know how you distance children so of a certain age that don't understand some of the social distancing routines. Some of the activities that we've done as well, one of them is kind of an activity which is a physical activity. We've put kind of tape on the ground for people to stand in a certain kind of circle, square, triangle for when they're doing that particular activity. It's some of those, like I say, it's not rocket science. You have to kind of think in a slightly different way. How can we do this? Is there any way of doing that? And sometimes you may all come back and go, no, there isn't. It is what it is. PPE, risk assessments, and we'll do everything that we possibly can. And then people will also need to make some informed choices. Some of our clients haven't returned to work, haven't returned to service. They don't feel ready to return yet, or they're shielding, and that's absolutely fine as well. We'll support them on their return, but it's also respecting that some people just aren't ready, and they're still very fearful about returning.
I'm sure that's the case. I have seen some field parks and village halls and community centres where they've actually put big circles on the floor, and kind of like, that's your area, that you can work within those areas, but you mustn't go outside those areas, which I'm sure will be very helpful as well. Got a question from Wayne Eckersley. Should youths be expected to wear, the government has announced that face masks will become mandatory next week in all shops, etc., but not in offices. Should youths be expected to wear masks inside, in, for example, community centres or other spaces where they will congregate? And I think, Sarah, if I could probably, are you best placed to answer that?
Yeah, I can do. The guidance says that if you are unable to socially distance or you're in a crowded area, then a face covering is advised. But the guidance also says, and this is the problem with the government guidance, a lot of it is contradictory at times, is that anybody under the age of 11 doesn't need to wear a face mask. I think it's 11. I know for definite under the age of 3 they shouldn't be wearing face masks. So I think it's about having those, and I think Michelle talked about these before, is about having mitigations in place and controls in place for those sorts of gatherings and occasions. So for example, your hand sanitizer, you are putting as many controls in place as you possibly can, as Louise said, with regard to chairs and facilities for sitting down and marking floor space and things like that. But also, and I want to bring this in here if possible, is about the contact tracing that we require. If you are sort of doing any sort of, when individuals are coming back to work or meeting to do an event, for example. So one of the mitigations that you can put in place is that you will keep a record of who's attending and when they're attending and for how long and who and which groups they've had contact with. So if you're wanting to do, say, a group activity, again, putting a big circle on the floor is a really good idea, and saying you 6 individuals do not move out of that circle at any one time. But then you've got a record then of who those individuals have been in contact with within that circle, so that if there are any positive cases, you've actually got that contact tracing in place from the start, rather than trying to do it at the end.
Yeah, thank you very much, Sarah. Hopefully that also will go some way to answer Mark Emery's question, although he did actually bring in the GDPR question as well. Does anybody want to take that up?
I think the restaurants have had to do this. For anybody coming into their restaurant, they've had to have that information, and we saw within the first couple of days the system worked. That landlady contacted 90 people off her own bat, didn't she? Because she had that information. GDPR rules are the same. They've got to keep things, confidential and in a secure environment. So lockable cabinet or scanned and a secure with a secure server. Because I think, like Sarah said, that is really, really important, and that comes into the planning, doesn't it? That if that's part of the new procedure, then that's what people need to be made aware of. And if the benefits are explained, then nobody should have an issue with it. And one of the things that came up in one of the webinars that I was listening to from it was environmental health, actually, was it's classed as reasonable details, so that you don't need to take the whole medical history. You just want the bare contact details, and that's acceptable.
Okay, thank you for that. And going on from the lady from Elaine about the Woodley Methodist Church, grouping. Janet Ketteringham said, can we open our preschool parents and child group in the parish centre? I think that's maybe one for you, Jo.
Probably one for Sarah, to be honest. I'm just again, you know, it's about doing that risk assessment and understanding, you know, how many children you can take, and I think, you know, I've got a son who's in school. He went into school for a week last week. He's 4. He's not socially distancing. The teachers said there's no way they can do that. They can try and limit contact, but you're sending your child in at your own risk at the end of the day. So I would say a thorough risk assessment, ensuring that the space is fit for purpose, and that you can you know, support people to return. But Sarah, do you have anything to add there?
I'm just thinking about that. Obviously, nurseries have returned to being open, not just for key workers now. Yeah. And the controls that they've got in place, again, it's down to the risk assessment approach, but it's things like having staggered drop-off times for individuals to drop their children off into these settings, staggered collection times, so that there is that reduced contact. The parents don't go into I mean, obviously, if it's a mums and tots group, that's slightly different because you've got mums going in with children. But if it's a preschool, for example, children can be dropped off at the door, and parents don't go any further than that door. It's about making sure that you've got adequate cleaning in place, and you've got the right cleaning materials. You've got the right that your toys and things like that are cleaned on a regular basis. That if you are, the children are encouraged to wash their hands, and if they can't do that themselves, that you assist them to do that. So it's about having all of those controls, all of those risk mitigations in place, and again, knowing who's in the building and who's not in the building, and what sort of contact they've had with individuals, so that if we do have a case, we've got that track and trace system in place. Again, making sure that we keep the information that we need to keep, and nothing that we don't. So the national test and trace system it's a name, it's an email, and a mobile number or a landline number, depending on which one you've got. So those are the three key bits of information that are needed, and having all of those mitigations in place actually means that you can have a safe environment for anybody that's attending.
I think, yeah, that's right, Sarah. And I think just to add to that, I think it's thinking about business continuity as well. If you're going to reopen your service, you know, the approach that most people have taken, particularly around childcare and schools, is creating bubbles. So if you can contain any outbreaks quite quickly, so the whole school doesn't then have to close its doors again.
Yeah.
So I think really thinking through that, because what my worry is that, you know, we put in all this effort and time to reopen, and suddenly, you know, we have an outbreak and you've got to shut it all down again. So really thinking about that risk assessment, you know, can you create bubbles? Can you create, make sure that, you know, you can shut down things very quickly in a kind of phased back approach, rather than just fully shut down?
Just adding to the whole test, track and trace situation, Lizzie Austin has just been talking about something that was mentioned in the captions of Teams around place meeting this morning, and she's saying, are you expecting, or are the volunteers expected to store the data?
There is a requirement to store data for at least 21 days. Okay, and the reason we say 21 days is because we've got the incubation period for the infection is 1 to 14 days. So actually, by keeping it 21 days, we've then got a 7-day period at the end of the 14 days should anybody develop symptoms at that point. So it's a minimum of 21 days.
Okay, thank you very much. That'll help an awful lot of people. And also, if another member lets them know they have tested positive, will this be the volunteer group leader's responsibility to call and tell all the other attendees as well that they need to be COVID tested? So
what happens is that we have a national system. Obviously, we've got the NHS test and trace system, and they respond to any positive cases. And at that point, if there are difficulties getting hold of the contacts, so for example, we'll use the pub scenario, for example. If somebody goes to the pub and they then find out that they're positive, we had the example of the landlord okay, that they could actually do all of that contact tracing proactively if they choose to, but actually they don't actually have to. NHS Test and Trace could do that proactive contact tracing as long as the individual who's positive has the numbers of everybody. If they don't, obviously they will go to the landlord and they will get that information from the landlord, and then they would do that contact tracing. If it becomes very, very complex, or there's further work that needs to be done, we do have a Greater Manchester contact tracing hub where all of those sort of situations are being escalated to, and we have a dedicated team at Greater Manchester who again will facilitate and support that process. Again, if it becomes very, very complex and there needs to be either feet on the ground to do those to do contact tracing, or for example in underserved populations, or we need to do some further consequence management, so whether that's the closure of a whole building or whether that's a closure of an area within Stockport, for example, as we've had in Leicester, then that's when it comes down to the locality team, and that would be my team. We would then look at the situation, and then we would determine the contacts and any further work that we need to do.
Okay, thank you. I think there's another question in here that is talking about, what if someone attending, for example, a male mental health support group feels uncomfortable about leaving personal data, and if they had to and they couldn't attend, but they're at risk of isolation and loneliness, is that something else that anybody in that situation would be able to contact your team for further advice, Sarah?
Yep, certainly they can ask us for further advice, and it may be that what we do at that point then is link a little bit closer with any sort of support services and links that we've got with, say, for example, drug and alcohol services. They may be known to other services, and we can actually do it that way and try and locate those contacts of those individuals.
Okay, and another one for you, I think, Joe. What about access to grant funding and support funding that might be available to help some of the sector to actually, the third sector, to actually access funding to help them to continue to offer the services? Are you able to supply that information to them?
Yeah, I can give an update. The short answer is there isn't any funding out there for reopening as such, unfortunately. And it's a shame, because the bigger organisations can open, probably have more resources to open, because they've got access to operations managers, health and safety, etc. So what I would say is that if you are struggling and you do need some whether it's money or advice to reopen, then contact us directly and we can put you in touch with people. But I have spoken to the National Lottery, who are running a COVID response fund at the moment, and they have now included PPE and reasonable readjustments to community settings to account for social distancing and risk assessments as part of their grant. So if you are putting in you can't put in just for that, but if you are putting in a grant application to the lottery, then you can include that now. But I did want to get a bit of a temperature check on that, really, from the audience today. Is that going to be a barrier to reopening? Do you foresee kind of additional costs that you can't cover about reopening? Because if that's the case, then I can do some lobbying and look at how we could support you in getting a small grant, for example, to help you with this.
Thank you, Joe. Just trying to get through. We've had some fantastic input and some questions from the audience. So I do thank you for that, and we might not be able to get to cover them all. In fact, we won't. But I'm trying to get through as many as a selection to help people. It's just this will probably cover a lot of community centres and village halls and shared workspaces and shared spaces. Who is actually ultimately responsible? So if you've got a building that is used by a number of different community groups, whose responsibility is it to make sure that it's left in a very safe state when the next group comes in?
Can I answer that?
Yeah, thanks, Michelle.
It needs to be at any multiple occupancy buildings. It's a shared responsibility. for the usually for the upkeep of it, depending what the agreement says. But I think in these circumstances, everyone needs to communicate. We call it the 3 C's: communicate, cooperate, and coordinate, so that everyone's working to the same aim. So in this case for COVID, we're going to have to go over and above. I would expect each group to do their own cleaning after they've, they might want to do it before they go in. I would say to do it before they go in, whether it's just wipes and things like that, or the spray and the paper towel, and certainly everything that's been touched and used during and then as they leave. So things like toilet flushes are going to be, touch point. I call them touch points. You have to walk the land and see what the touch points are there that need a special attention if there've got to be lots of people using them. So it's really a shared responsibility. Whoever, if there's a caretaker on site, they might want to come in between groups. Bookings are going to have enough space between them to allow for this extra cleaning now, as opposed to one after the other. But it's going to be a conversation, isn't it? Some communication, and every place will be different. Some people will be given keys and off you go, and they'll pass them to the next group, whereas others, there'll be a caretaker going in to check everything in between. So it's got to be an open discussion, but everybody will be expected to behave in a reasonable manner.
Sarah, can I just ask you, will there be in multiple use places like community centres, etc., will there be somewhere where people can actually access a list, or for council owned premises, for instance, will there be posters put up so people know exactly what they've got to do?
I would assume for council owned premises, we're working through those at the moment. And I know that there's some guidance that's just come out today with regards to the use of a multi-use settings, so that might help with your question beforehand. But yes, as far as I'm aware, the council-owned premises should be being signed up.
Okay, and that documentation, that checklist, is that available somewhere where people can go and download their own for people like village halls, church halls, community halls?
Not that I'm aware of, but I can certainly ask. As it might only be a guidance document to say consider this, consider that. I think Joe's got a hand up.
Yes, she has. Joe, do you want to come in on that?
Yeah, just to say, I've posted in the chat the government documents around the safe opening of multi-purpose community facilities, and like I say, Sector 3 have developed a checklist for groups and organisations, which is based on some of the knowledge and the work that Louise has done. And Louise, quite helpfully on her website, you can actually see her risk assessments. So if you're looking for an example risk assessment, then please go there. And again, I've put the links all in the chat function. So but we'll make sure that those links are emailed out as well post event. So
okay, thanks very much for that. Somebody's still asking, Michelle, can you just repeat the 3 C's, please?
Oh, communication, cooperation and coordination.
Great, okay, thank you.
Yeah.
Ian Kirkpatrick is a volunteer at a job club in Marple, and has been doing a few things remotely and by email, but have been unable to help folk with no limited or limited digital skills or access to IT equipment. His question is there a safe way to meet someone with a laptop? Typically, this can involve sharing the keyboard and help them apply for jobs online. As volunteers are often retired older people, is it safe to engage them in face-to-face volunteering activities? Sarah, are you best for that one, or Michelle?
I suppose again, it's putting it's doing the risk assessment before you meet that person. So, for example, does that person have any symptoms? Have they been, identified as positive, or are they a contact of somebody, so should be self-isolating for 14 days? So that's the first thing you need to be doing, which is that risk assessment about the individual. We know that up to 6 individuals from from different households can meet outside now, so that guidance is there. So yes, you can meet in a park. With regard to the use of shared items such as laptops, then I suppose it's about the mitigation for that use. Again, it's about things like making sure that the person cleans their hands before they use the laptop and the keyboard, and ensuring that the keyboard is cleaned in between use where possible. Wiping over with a detergent wipe, detergent disinfectant wipe, that sort of thing. So there are lots of mitigations we can put in place, and there is guidance already out there about meeting somebody in a park. Obviously, the individuals who are over 70 or those who are shielding are potentially more at risk of developing severe complications from developing coronavirus or COVID-19. So it's about making sure that it's safe for those individuals to attend as well, and keeping the 2 metre social distancing where possible. So even if you are sharing a laptop, it's about not sitting on the same bench, for example, in a car in a park, but trying to do that as distanced as possible with all the other controls in place.
Hi, sorry, can I just add to that as well? This pandemic is just going back to the point that the questioner asked, was around digital access, and it's really highlighted that there's many people that aren't online or can't access IT, and we've pivoted all our businesses, now we do stuff online, and we're at risk of excluding a lot of people. So I'm just wanted to highlight the fact that Stockport Council and Startpoint in Woodley have developed this really great digital champions service, which can help people to access things online and maybe help towards getting IT kit and things. So I'll post their email on there.
Thank you. And also, as far as the risk assessments are concerned, the risk assessment templates are concerned, Joe, I guess they are available on the government website in terms of what documentation is available to help Sector 3 groups. Is that correct?
I don't know whether they're actually on the government website. They may be, but I've got examples, worked up examples that Louise has done, which would probably be more helpful, I would imagine.
Okay, thank you very much. And I guess this is probably one for Sarah or Joe, who are sort of more involved in as far as the Stockport Council is concerned. What is the plan, process and timescale for the council to open up its public buildings, such as the town hall, to its clients? Anybody have an answer to that?
I don't at the moment, no, sorry. I know that there is work underway to reopen elements of the council buildings, but at the moment I haven't got a fixed date. I think Louise wants to come in.
I've asked about public toilets. They're a huge concern to us, public toilets, and some of the public buildings in some of our green space across Stockport. So I have asked what is the plan. They are apparently, Stockport Council are currently working on this now, and there is going to be a plan to be opening some of our community buildings in our parks and some of the public toilets as well. Yet to be determined when, but they are working on it now. Okay,
a couple of things with regard to taking contact details in the contact track and trace for the register. Andy Stoker has just reminded everybody it's a should, not a must, but there are ways to help. If people really want to, they can drop details into a closed box, which is great advice from Michelle. Apparently, according to the BBC Breakfast News this week, people refusing to leave contact details could be refused entry. But I guess that is again down to the owner, landlord, manager of each building. I guess that is it. I'm just looking down to see what other questions we've got here. So I'm looking at about 3 devices here. What's the maximum number of people permitted to meet in community groups? Is that down to how far so you can manage the social distancing?
I think so. I don't know if there is a maximum number. I've not seen of any maximum number. I think it all depends on the environment and potentially the activity that takes place in that environment. And if you can set out the environment where social distancing can be adhered to, and again, it depends on the activity that is taking place in that environment. But I'm not aware. I've not heard. I don't know if you have, Sarah, of any maximum number.
The only number I've seen is actually the number, the 30 number, which somebody's just popped in the comments around there can't be gatherings of more than 30 externally, but I haven't seen any other update on that.
Okay, I think it's 30 for public gatherings like weddings, isn't it?
Yeah.
And I guess it's, if you've got a small parish, small village church, the numbers are going to be very different from those who've got, if you're looking to do something in the cathedral, for instance. So I guess you've got to just kind of work within the facilities that you've got and work it out according to the guidance. And another interesting question here is how do we safely dispose of PPE used by staff in those kind of environments?
So if it's a clinical environment, so for example, I think from Louise's point of view, where they're offering day services, that needs to be disposed of as clinical waste. Any other PPE, this is a difficult one, because if you are providing personal care, then you should be disposing of that waste, that PPE waste, as clinical waste. Okay, but if you see somebody walking down the street with what looks like a disposable face mask on, then that waste can actually just go into normal black bag waste. It doesn't need to go into clinical waste.
Okay, well, thank you very much for that. Just before we close, we've got 1 minute to go. Does anybody have a pressing question that they'd like to put before we finish? Okay. I think we tried to cover absolutely as much as we can on these. Okay, that just leaves me to say then that, can I just say thank you very much to everybody who attended today. It's been really good to see that this is a webinar that is of interest to so many people in so many different groups. And I'd also like to obviously thank our panelists. And just to reiterate that there will be a recording of this put on the skbusinessrecovery.co.uk website, along with if anybody's got any questions that they'd like to submit. I think Jo's put her details. Have you, Jo? We'll put the panelist details up there anyway on the SK Business Recovery website, so that if there is anything specific that you'd like to know, then we can direct those questions at the right people for you. So can I just say again, thank you very much indeed for attending the webinar today, and I hope you've all found it very useful. Thank you.